Thanks for joining us at 5. I'm Art Edwards. We have some breaking news out of the workers' strike by the Oregon Nurses Association at Providence hospitals. Within the last 20 minutes, the ONA announced that hospitalists at St. Vincent's voted to ratify their first contract with Providence. This affects more than 70 workers at that hospital. It comes after nurses at 7 Providence hospitals in Oregon rejected Providence's latest offers last night. With me in the newsroom right now is Celine Stevens. Celine, you were able to speak with the union today before this latest announcement came down. What did they have to say?
Art, that's right, I did. But first, I want to mention this. All because they gave that unanimous vote to ratify the contract, this doesn't mean that the hospitalists stopped striking. They will continue to hold the line in solidarity with the St. Vincent nurses. But as for last night, out of a 92% turnout across the 7 bargaining units, the Oregon Nurses Association reported that 83% of voters voted no. Today, on what is now day 30 of the strike, they discussed some of the reasons why.
Providence can do better. And if they want this strike to end, they must do better.
The largest healthcare worker strike in state history hit the 1-month mark Saturday, and it appears there's no end in sight.
This is about more than money. It's about respect. Nurses here at Providence hospitals have carried this community through a pandemic. We've worked short-staffed. Instead of acknowledging our worth, Providence treats us like an expense they'd rather not pay.
Saturday, Providence said in a statement that the Oregon Nurses Association have guaranteed a longer strike for its members. But nurses expressed frustration about the deal Providence proposed related to not receiving retroactive pay for the time they didn't have a contract.
Providence owes nurses back pay. They have the resources to pay what is owed, yet they refuse. Instead, they've dangled the idea of a ratification bonus, a bonus in lieu of retroactive pay.
Providence said in a statement nurses were offered an average 20% increase over 3 years, and the ratification bonuses were up to $10,000. But nurses say
the vast majority of nurses will never qualify for a bonus that high under Providence's latest contract. Those bonuses don't get close to what many nurses have lost in pay increases while working without a contract.
They also say the health insurance is unaffordable and inadequate.
Nurses have been left with fewer options for care, higher costs, and constant roadblocks to accessing the services they need.
But Providence states their medical benefits package is the same that Providence senior executives receive. Also, nurses say that Providence is still not addressing safe staffing in the way they want.
Understaffed hospitals have become the norm at Providence, but this is not the status quo that Oregonians should accept.
Nurses say this is not just about them, but their patients and improving their quality of care.
What we're trying to do is establish the care we can provide for our communities into the future.
We miss taking care of our communities. We want to be back in there too. We love our jobs. We love getting to work with each other as well, and our patients feel all of that.
Now, we're still waiting to see the outcome of the Providence-Medford vote, which wrapped up at 4 p.m. Providence also said in a statement that their bargaining teams are considering next steps and are working with federal mediators to determine what comes next. Art?
Thanks, Celine.